I'm Lothar Wieler. I'm the former president of the Robert Koch Institute, and now I'm holding a chair at the Hasso-Plattner Institute, Digital Global Public Health, and I'm chairing this session together with Annelies Zinkernagel.
Good afternoon, everybody. It's a pleasure being here. My name is Annelies Zinkernagel. As you heard, I'm an infectious disease specialist working at the University Hospital Zurich, University of Zurich, and I'm also the immediate past president of ESCMID, and I'm really looking forward to the next session. So with that, I'd like to introduce our first speaker, JP Nemes, who works at the WHO as the acting director of Global Coordination and Partnership Department. He's also serving as the interim director of the Quadripartite Joint Secretariat on AMR, coordinating the quadripartite team, focusing on multi-sectorial activities against AMR and supporting the global governance structures for AMR. Before joining WHO, he was the permanent secretary of the Ministry of Health of Rwanda, and it's a great pleasure having you here. Please do it, JP. Okay.
Apologies, I have to navigate the. So I have to close this. Thank you so much for the opportunity. I will go quickly through a few slides. And as I have been introduced, I'm here representing the Quadripartite Joint Secretariat. I'm pretty sure most of the people in the room knows what is the quadripartite. These are 4 organizations that came together progressively. The young one among ourselves is UNEP, that joined officially in March 2022. And we were working together to promote the AMR response in a One Health approach. We have a joint secretariat, which I'm honored to coordinate. And we do a number of things. If I just try to give you a few of them, we offer secretariat functions to the global governance structures, including the GLG, the multi-stakeholder partnership platform, and soon to come, the independent panel, which we'll talk about. We coordinate also the multi-trust partner fund, and also technically support the countries to promote a One Health response to AMR. I will start by independent panel, which is one of the key commitments, which is time-bound from the 79 UNGA political declaration. However, as you know, this is not a new idea. The Interagency Coordination Group in 2019, and later on by the Secretary General of the UN, had already recommended the establishment of an independent panel on evidence for action against antimicrobial resistance. It didn't start because of a number of issues. However, we have a unique opportunity this time around because the member states have all in unison recommended that we establish this. So the quadripartite organizations, through the Quadripartite Joint Secretariat, we have already met and came up with a roadmap, which was on my slide before. Now, we can discuss this, but already we know, or we have ideas of why the independent panel on evidence is going to be useful or critical for AMR. One, effective AMR policy making needs reliable, interdisciplinary scientific evidence. The first panel has covered that. Second, AMR response, or AMR as an issue, it's a complex issue spanning across different sectors, and we have fragmented data. That's also another element or rationale, constituting the rationale of why we need an independent panel. Evidence gaps, there are many. I think the first panel as well alluded to some, but as well we understand that some in similar places where they had an independent panel for science, that did make difference. And my colleague Abdallah will talk about IPCC in a minute. Now, if you quote the political declaration, and we all probably have seen it, the member states said this: the quadripartite organization to establish the independent panel on evidence for action against antimicrobial resistance by 2025. That's December. I would say around 8 months from now. It's quite ambitious in terms of timeline. And the member states were very clear that the independent panel should facilitate the generation and use of a multisectoral scientific evidence, utilizing existing resources and avoiding duplications in order to support the member states in tackling AMR in a One Health approach. The quadripartite organization, we've met since, I would say, November of last year, putting together our minds on where to start and where we get the resources, how do we do it, and so forth. And then we are proud to say that we have put out there a roadmap on how we're going to be doing this. Because, one, the member states were also very clear that it has to be done in a consultative and transparent and inclusive process. So the way to start for us has been a landscape analysis, and I will present a little bit about that. So we are making a comparative analysis of the existing science panels, and we are completing that this month. Second, during this month as well, we are just making a database of the stakeholders that we're going to be engaging. We're using multi-stakeholder partnership platform as our one of our governance structure that is already hosting close to 250 stakeholders, but it's not going to be the only way we're going to be consulting stakeholders. We're going to go beyond that. Then we're also developing an engagement strategy. We're going to be calling for written inputs in the process, and then we'll embark on a member states consultation, a formal consultation with the member states. As I said, we envisioning to launch this panel around December. And some of the events that are happening in December includes the UNGA, which is happening in December. That could be one of the opportunities that we can look for to launch this panel. Now, the landscape analysis is halfway. And we have already, let me first maybe clarify why the landscape analysis is going to be useful for us. We believe we need to come up with very clear questions that we bring to the member states or the stakeholders of where we need the inputs on. So the landscape analysis, we are comparing similar panels, and we've taken just two, IPCC and IPBS. And we have more information about the other scientific panels that we're also using to come up with a landscape analysis. And we want just to collect the key elements that will help us to establish an independent panel for AMR. Already in the functions, we kind of have a pretty basic basis that we can start with, because the political declaration as well gave us some ideas. I think we believe the IPA, sorry, I will be using IPA to stand for Independent Panel on Evidence for Action Against Antimicrobial Resistance. We might revisit that acronym, but for the moment, IPA. We think it will be doing assessments. We'll be doing horizon scanning to see what the emergencies are coming, to do knowledge management, two-ways communication, communicating with the policymakers, communicating to the scientific communities, policy support, and capacity building. So we based on what we saw the other partners are doing currently. In terms of the membership, we believe for it to be legitimate, have credibility, it has to be close to the governments. So it might come to be an intergovernmental panel as well, or another similar model. What that means, should the members be government appointed? So these will be the questions we bring to you and other people to discuss. Governing body, it has to be having a strong governance structure, and we're thinking it might be composed of governments as well, but should they be selected member states? Should the quadripartite organization be part of it? What will be the function of the governance body? So we are doing all of this in the landscape analysis, trying to understand and learn from the others. The modalities of work, should this discussion be in a closed setting, or should they be inviting other stakeholders to participate? So these are the type of questions as well we are bringing on board. And then should there be an administrative arm and then a scientific committee? Should they have different roles for the panel to be efficient and so forth? So I will stop there for the IPA. I'll pause. But I hope you keep these questions, and then from the audience and from the discussion, we can come back to that. Now, just a short presentation around updating the GAP as well. So the GAP has been there from 2015. It's a governing document. It's a strategic document. It has been approved by the WHO in 2015, but later on was endorsed by the other 3 organizations, which is good, because that gave it a legitimacy to become a kind of guiding document across different sectors. It has made an impact. I think we all understand, we all agree. I mean, 178 countries have the national action plans, and they are all really inspired by the GAP. When you look at the structure of those plans, what do they include? How do they prioritize? GAP has been really the cornerstone of that. And we know that it's not so great in terms of financing and implementation of the national action plans. So that is something we need as well to tackle going forward. Now, the 79 UNGA political declaration as well called for the quadripartite organization to update, not to write a new GAP, not to review the GAP, rather to update the GAP and ensure a robust and inclusive multi-sectoral response through a One Health approach. I think this is going to be critical, that we also undertake this very well and in a consultative way, so that we have a next plan that's going to take us for the next decade. There are different areas that have already been identified through the consultations and discussion we've had with you and other stakeholders. So the current GAP, although people think it's still a nice and really a very sound document, however, most of the voices that we've heard say that it lacks concrete elements around accountable global, regional, and national AMR governance and coordination mechanisms. It lacks more on the environmental dimension of AMR. It lacks, again, more substantive direction around diagnostics, laboratory capacity, surveillance across human, animal, and plant health sectors. The need to reinforce a One Health approach is also not there as people want to see it. And then it doesn't have as well the targets. It doesn't have some of these metrics that we're fortunate to have from the political declaration that we think with the update of the new GAP, we should really bring those in. There is, again, another phased approach we're going to pursue. It's also, again, starting. So we're going to run this process in parallel. So it will be a landscape analysis, which is more evidence-based. Where are we? What are the gaps? What's the new landscape of AMR response or AMR issues? And then there will be initial consultations. You might expect to see a survey in the coming weeks, where we're going to be asking you to point out to the gaps that you already see and areas you think should be the focus with a new updated GAP. However, you also have a different route compared to the IPA, because this is going to be more of a usual heavy bureaucratic governing bodies process, both from WHO, WUHA, FAO, and UNEP. So we'll have different engagement with the member states at the regional level, at the HQ's levels, both in Geneva, Rome, Paris, and Nairobi. So there will be heavy bureaucratic compared to the IPA, I believe, because they have to be endorsed by the governing bodies. So we hope by mid next year, we can have one governing bodies passing the GAP, but we have to give ourselves until the end of 2027 to align to the UNEP. The next assembly they have will be in 2027. So we'll have different time for approvals, but we hope to complete this by 2027. Now, as I said, coming soon, there will be an electronic survey that will come to many of our experts. It will take you about 2 hours, but don't worry, you can save and come back to it. It's not going to be like 2 hours seated and finish it. But it's going to be critical because we believe the scientific communities and implementation agents or people are the best to know exactly where now issues are and comparing what the GAP has done well and what the GAP hasn't driven well. So we really rely on this step to be able to know exactly where we start by updating the GAP. We'll have MSPP, as I said, which is going to be one of the key consultation platform we're going to be using. And then we'll also try to be very transparent in posting all the materials to our website, QGS, AMR, that we have that is already functional. And I hope you get some time to go there and see what we are coming up with. The key areas for the survey, I don't want to dwell much on this. You're going to see it. We'll be asking you, do you think the 5 pillars, the 5 objectives are still the ones we should really keep? Do you see some rewarding or editing of those? Do you see any other area that needs more attention when we're moving forward? So all of these are going to be the questions we bring to you to collect your views in order to proceed. Just as a summarize, I think 2024, we continue to say so, was really a good year for us, a big year for us, AMR people, AMR community, I would say. We are now in a different landscape. I think we all agree that from September to now, some people think it has been like 2 years or 3 years because of the changes that have happened. But we want to keep and stay grounded on what we have from the member states. That's why we are still sounding ambitious, and that's why still really calling for everybody to come and we concentrate on delivering of these things. The QGS is your organ to coordinate a joint response, and we'll consult with you. We'll be very transparent. We'll post all of this information on the public platforms, and we'll listen to different groups as well that are doing something that is building to our work. And then the upcoming consultations, please pay attention to that. We need you to be engaged, we need you to be responsive, and we need you to reach out. Thank you so much, Chair.
Thank you so much, JP. So the session is on the Global Action Plan and the panel. And while we are trying, or the quadripartite is trying to set up that panel, I have the great pleasure to introduce you to Abdallah Moqsit, who actually has been working on such a panel for years, and the panel, the Intergovernmental Panel on Climate Change, that obviously has a huge impact on policy, and obviously the AMR like to have such an impact. Abdallah is the secretary of the Intergovernmental Panel on Climate Change, a position that he is holding since 2016. Born in Azrou, Morocco, he has an impressive academic background, including a master's degree in mathematics from the University of Rabat and advanced studies in meteorology and telematics in France. His career spans decades of contribution to meteorology and climate science, including leadership roles in Morocco's National Meteorological Department and involvement with the World Meteorological Organization. Moqsit has been recognized for his efforts in modernizing meteorological services and advancing climate research. And we're very much looking forward to your presentation.
Thank you very much, dear moderator. I think I'm feeling a little bit, honored. But I am already honored to be here, and I'm really thanking you to inviting me to share with you the experience of IPCC. I'm also honored to be in this panel with eminent participants and becoming one as well. And really, I learned, by the way, I came here, I'm really happy because I already learned many information about your activity, and this is really important. I want to start already by asking the audience, the one who knows about IPCC, if they can raise hand. Thank you very much. I think that in the past, I think 10 years ago, when we asked and not just to say if they know about IPCC, it was not the same number. And this is something which is really important to highlight, because this is something that show, how we are assessing the progress about how IPCC is well visible. And the other thing, let me highlight that the last COP in Azerbaijan, believe me, 90% statement from policymaker. In their statement, they say there is IPCC. This was not the case many years ago. I will share with you the history of IPCC. IPCC was established in 1988 by two parent organizations, the World Meteorological Organization and also United Nations Programme of Environments. And this is one, because you asked me to share with you my experience. Already the experience started by the good definition of the role. If you want to establish a good forum with policymakers, you should not show them that you are going to work in their area. This is why your definition should be clear. So the IPCC role is to assess on comprehensive and objective and open, transparent basis, scientific, technical, and socioeconomic information. We are not doing research. We are assessing research. We are not doing research. We are assessing research. Something which is really important about how to be, you should be accepted by the other part. And something which is really important, that our assessment should stay neutral in regard with respect to policy. We are not dictating any policy and option. We are just offering to policymaker the level of science, and this is kind of also something that should really be really well established and well clarified. I will really bring you in the journey of IPCC. We are now almost 36 years of the life of IPCC. And in this slide, you can see from the inception, we already did have one client, one customer. It is United Nations Framework from Climate Change. They are representing policy. They are parties. And let me highlight to you that from the beginning, 1980, the first assessment report was critical even for the establishment of UNFCCC. Second assessment report, 1995, was critical for Kyoto Protocol, which was used by policy, by governments. The third assessment report in 2001. This is something really important because it was the first report introducing adaptation. But adaptation is for policymakers, for countries, to adapt to climate change, and it is needed by governments, and this is why the third assessment report was targeting this aspect. This is the interface with policy. The fourth assessment, and this is really also important, it was delivered in 2007. But you see, it was the first report including, raising numbers. We start to speak about anomaly of temperature. But let me highlight to you something through this. It was a sort of translation that science is advancing. But in the same time, the certainty or uncertainties are going down. That we are demonstrating that the confidence is there. Because if you have a minister, you should not discuss with him if you are right or not. You can say, hey, I have this, I have strong information, and you have just to use it. This is also, and this report starts by raising numbers. When you are dealing with numbers, that means we are sure, and our model are accurate. And then this 2007, IPCC got Nobel Prize, Nobel Peace Prize. This is also another artifice that make the policymaker listening to you, because it is sort of recognition. 2014, I think the fifth assessment report was critical for Paris agreements. I think the first time in history, this is the international agreement, but what was behind is IPCC assessment report. And 2023, once again, the assessment was critical for first global stocktake to tackle climate change. This is just one client, UNFCCC. But IPCC is not limited to clients. We have many clients, as UNFCCC, but we have many clients, stakeholders, individual, rural women, scholars. All students are also interested by IPCC, and you should, because the policymaker is not dealing just with negotiation in COP. Policymaker is living life, day by day, in country, dealing with all the discipline connected to life, the well-being, and saving lives and goods. And this is why IPCC, for us, it is like a carrefour of all this discipline. Because if you want to interest policymaker, you need to tell them, we are touching social, we are touching finance, we are touching even socio-economic aspect, we are also touching agriculture, water resource management, and so on. This is all the kind to tell we are the good interface. Something which is really important. For example, this is the 7th cycle. And this is the number of products we are going to produce this cycle. But this slide is here just to tell you this list was discussed with the governments. It is not only scientists who decided, came and decided this is what we are going to produce. This. No. This is a sort of command came in from policymaker asking us, we agree, just they agreed to allow us to prepare this report. Already policymakers are involved even in the choice of our program. By definition, at the end, they will accept because they were the one who requested. So they will be the one who will listen to this report. Policymaker is this situation. The interface is this one. When you have negotiator, when you have government representative, administrator, director, and you have a whole scientist. And this is exactly the situation what each one should learn how to listen to the other. Scientists are publishing papers. Policymakers are taking decisions, mobilizing resources, money, and taking decisions that can influence the kind of life in their country. Decisions that can even push them to be re-elected or to not re-elected. And I think each one should understand the other. And this is really important if you want to keep a good interface between scientists and policymakers. And I think, of course, I know that you want to establish something similar. But it is also about structure. You should really think about the best structure or best organigram that can fit, that can create this spirit of interface between many, many actors. Because you have the parent organization, you have the panel, which is composed by 195 countries. And you have also structure, the bureau, the executive committee, working groups, and all the working groups dealing with any area related to climate change. And you have, of course, authors and working on basis. I want to stop on this, as I said in this slide. And you have in the left-hand side the panels, governments, parties. You have in the middle secretariat and the actor, structure facilitating the work. But you have in the right scientists, 100 or 1,000, working on voluntary basis. And this is the interface. I think this is the interface. Each actor in this slide should feel that the other one is listening to him, and he should really demonstrate that he's trying to produce added value, and vice versa. And this is, I think, the mechanism that should be there. IPCC is working on voluntary basis with scientists and voluntary basis, even with financial contribution, and it is working in voluntary basis, even in the interface between when we have the discussion between scientists and government, it is not something which is forced. It is smooth. It is negotiation. this is a slide I like. And I think this is the slide that only IPCC is implementing. It is the 10th step. To keep the word, this slide memorable, I am calling it 10 Commandments. And this demonstrates that from the inception, from the decision to prepare a report till the end, we should follow this. And this, what it means? That means we are in continuous interaction, discussion, negotiation between scientists and government. It is, first, it is the government accepting that we prepare one report. It is government nominating experts to attend the scoping meeting. And scoping meeting is, the meeting where we are producing the outline of this report. And this outline should be approved or agreed by governments. Outline is a number of chapters. Then we are launching nomination. And nomination, government are nominating and observer organizations are nominating. But it is the Bureau selecting. Nominating, selecting. Then we start, when we select the authors, then we start drafting. We draft. Then we have the first thing is we launched an expert review. Why? And this is put it in the context of policymaker. We want to make the policymaker trusting as maximum what we are drafting is good report. And any expert can be reviewer of IPCC draft just by self-declaration. By self-declaration. I am expert. I have some knowledge about chapter 5. I am also committing to not share any information. Should be confidential. So please send me your drafts. I will comment. And we are taking consideration comments. Then we have government review. The drafts are reviewed by governments. And we are this first order draft, second order draft, zero order draft. We will have final draft and we have summary for policymaker. Summary for maker, of course, it is reviewed by government. We are receiving comments. And summary for policymaker is approved line by line. It is approved line by line by governments. Drafted by scientists, approved by government. And of course, we publish the report. Those are the reports. You have many reports, and sometimes reports are thousands of pages. I have statistics that says that reports for 6 cycles, the whole set, you know how is the weight is 29 kilo. Believe me, do you know any minister, any prime minister ready to read one report just about 10 pages, 100 pages? Never. 10 pages? Never. I was the general director when the minister asking me to prepare a summary. If it exceeds 1 page, it is returned. So now the reports are there. 29 kilo is there, and this is demonstrating the value of science. It should be there. However, summary for policymaker is 35 pages, but it is too long. But we create a decision to have headline. For example, 35 pages can provide 20 headlines. That's, sentences. More than this. Even these 20 headlines are too long. Then we come with one sentence, one paragraph for each report. And I'm pleased to show to you this accordion. It is, when you can put it like, it is like visit card. But in this accordion, we have the report and the paragraph associated. Report, paragraph associated. Report, paragraph associated, and all 6 cycles is here. If I am prime minister, or I am king, or I can put it in my pocket, but I can't take it. I can read it, but sentences are here I can trust. This can allow me to take a decision. Why? Because it is coming from as a summary for policymaker, which was approved by my government. And this summary for policymaker, 35 pages or 40 pages, is backed by thousands of pages of science, peer-reviewed literature. And this is how I think if one advice I want to provide you is this is the kind of thing to adapt your language to the policymaker. Because with this, he can take a decision. With this, he can mobilize money. With this, he can also mobilize human resources. With this, he can even create reorientation in his government. So, another idea I want to share with you. 6 cycle, this is statistics. It involved almost 800 authors. Of course, you have distribution. We are looking for some balances. Female, male, developing, developed. I'm proud to say in this 6 cycle and this cycle, we are reaching this balance, 50-50. We assessed more than 100,000 peer-reviewed literature. And now the peer-reviewed literature are increasing, with a very, very, fast speed. And also we dealt with, and this is very important, we dealt with more than 300,000 comments from expert reviewers as well as governments. But be clear that any comments is taken in consideration. There were 3 cases. The comment is excellent, it is incorporated. The comment needs some tuning, it is tuned and also incorporated. If it is out, it is not taken in consideration, but it remains in our website as a matter of transparency. That means, do provide your comments, we will listen to you. This is for Nobel Prize. This is good because, and also, prime ministers, ministers are also invited by all this concept. Climate change, sustainable development. Sometimes they are requesting, what are you doing? Is it in line with sustainable development? We say yes, because at least we are making the work easy for them. So just another, I will conclude by this approach, even the approach of transmitting the message. Policymaker is not a mathematician. The policymaker is looking for a message that can create at his level or her level this motivation to take a decision. And this is kind of small presentation for our sensitivity report for 6 cycle. When the main conclusion were, we divided in 3. There was a warning that adverse impact from human-caused change will intensify. This is a warning. This sentence is useful for policymaker. So we can provide more detail, but it should be as simple as possible, not complicated. But there is hope. This is because if you are warning policymaker without providing hope, it's worthless. You should provide hope. And you should also provide elements that support, that back this hope. And this is kind of, all what I have in slide are sentences approved line by policymaker. Sometimes we are not communicating because we are forced to repeat exactly what was approved. And this is the hope. And hope is backed by science. But yes, if you are warned and there is a hope, there are challenges. And challenges also are there, and it should be coming with summary for policymaker. And this is exactly, for example, some challenges to cut the global greenhouse emission by nearly half by 2030. The challenge is precise, and you can translate it in one action. Okay, so also something that policymaker needs is also to give them a sort of track. The path forward is clear. There are tested options. Need to be designed for diverse contexts. Need to be scaled up and applied widely, because we are not dealing with one country. We are dealing with many, many countries everywhere in the world. Fairness. This is something we should really appreciate by all the countries. When we are discussing in the COPs, under UNFCCC, these words are repeated, and you should really provide the necessary element for it. Something which is really important, the financing, because someone spoke about implementation. But let's be clear. If you want to implement, you should have all the elements to implement. You should have the robust science that can provide you the good plan, but you should have also the possibility to implement. And sometimes, starting by finance. But the problem is not only finance, it is also the capacity to mobilize finance, the capacity to implement finance. There are many mechanisms in United Nations, but some countries are still struggling how to take benefit from this finance. So sometimes also we should explain, and I believe in this, I introduce it even myself. Sometimes you should take climate change as climate chance. And to try to tell people, if you subscribe to any effort of mitigation, you are in same time, you're improving your quality of life. You are in same time, you are creating wealth, and you are saving lives and goods. And this is what we call climate resilient development. So there are enablers for effective climate action. I think from the presentation, I followed before it, political commitment, inclusive governance, international cooperation, effective ecosystem stewardship, and sharing the diverse knowledge, starting by indigenous people and local knowledge. Yes, there are some, I will go quickly, the key of human factor. And also, if you have to establish this body, do it in the way that you can open the door to any to be involved. And you should explain to them how to get involved. This is what we did in IPCC, and this is why we succeeded to involve as many as possible. So thank you very much for this, for your time and for my invitation.
Thank you very much, Abdallah. A talk out of the hot kitchen, very interesting. Trust, respect, competence. We're going to move into the discussion, but I now call all three panelists, Sabia, Thomas, Javier. And you take a seat wherever you find some. And I introduce, Anneliese and we introduce one after the other speakers. I introduce first Sabia, because she will give a first comment. Sabia is professor as distinguished academic specializing in pharmaceutical sciences and antimicrobial resistance, and she holds the South African Research Chair in antibiotic resistance and One Health at the University of KwaZulu-Natal. Sabia, you wanted to say something, and then we move over to Javier and then to Thomas.
Thank you very much, and good afternoon, everybody. So I believe that the success of the independent panel of evidence on AMR depends on the 6 Ps: the people, the process, the principles, the protocols, the policies, and the practices. And let me unpack each one of these Ps. In terms of the people, the panel must be constituted by credible, credentialed experts and scientists, as well as AMR champions from multiple sectors and scientific disciplines. So we need trusted people with impeccable international recognition and reputations in their technical areas, but who are also AMR champions. And in my 19 hours of travel from South Africa, I started making a list of all of the disciplines I think should be represented on this panel, and I want you to listen carefully and tell me what's missing. So it should be, obviously, the human health and clinical medicine, animal health and veterinary medicine, agriculture and food systems, environmental science and ecology, microbiology and molecular biology, pharmaceutical sciences and drug development, public health and epidemiology, policy, law and governance, economics and health systems research, sociology, anthropology and behavioral sciences, ethics and global health. So you can put up your hands and tell me what's missing. I almost saw this like jury selection, so identifying people that would serve, but once they've been identified and endorsed by governments, they would be independent. So that was the people. In terms of the process, we want the appointment to the panel must be fair, transparent, and inclusive, representative of gender, age, geographies, stakeholder types, and technical expertise. And because the world is the way it is, we also need to ensure that there's representation from countries that are facing One Health infrastructure collapse, and because of war and conflict, and obviously Palestine and Ukraine come to mind. In terms of the principles, the work of the panel must be underpinned by the principles of transparency, independence, multidisciplinarity, equity, flexibility, relevance, as well as things like intergenerational justice, solidarity, shared responsibility, and accountability. And we can go on in terms of what types of principles we should include. In terms of protocols, there are well-established protocols and frameworks for assessment, as Professor Moxet said, that ensure transparency, credibility, and utility in policy making. And I think we as scientists are well aware of systematic evidence reviews like GRADE, the WHO Integrate framework, the EVIDEM framework, the environmental evidence protocols, realist reviews, and complex system approaches. Now, up to this point, the panel is working internally amongst looking at the available evidence, identifying and curating it. But all of this evidence and all of this knowledge must now be translated and synthesized to make an unequivocal health case, an economic case, a societal case, and a political case for it to be adapted and adopted into policies and practices. And for this, we require a knowledge translation strategy or a knowledge mobilization strategy. So one of the first and the key roles of the independent panel would be to identify or craft a knowledge translation strategy or a knowledge mobilization strategy. And I know that many of us are not very familiar with these concepts or the differences between them, so please allow me to give you the definitions. Knowledge translation, as defined by the Canadian Institutes of Health Research, is a dynamic and iterative process that includes the synthesis, dissemination, exchange, and ethically sound application of knowledge to improve the health of populations and strengthen health systems. Again, knowledge mobilization, also defined by the Canadian Social Sciences and Humanities Research Council, is the reciprocal and complementary flow and uptake of research knowledge between researchers and knowledge users, both within and beyond academia. So in addition to curating the available evidence and knowledge for the mitigation of AMR across One Health sectors, it is imperative that the panel develops a knowledge translation and a knowledge mobilization strategy, as well as an implementation plan. Thank you.
Many thanks for that statement. So with that, I'd like to introduce Javier Yugueros Marcos, who's the head of the AMR and Veterinary Products Department of the World Organization for Animal Health. He trained as a veterinarian, but also a biologist, focusing with special interest on microbiology. And so that's also where he worked and was heavily involved in the development and commercialization of diagnostic tests for infectious diseases, both for humans and animals. And now he's leading and coordinating actions supporting a responsible use of antimicrobials in animal health, as well as in other sectors, in close collaboration with the other quadripartite partners. And he's leading the international team accountable for the enhanced quality of veterinary medicine and diagnostics. And with that, I'd like to hand over for your statement, Javier.
Thank you very much. It's a pleasure for me to come here. I came many times as part of the audience. I was one of these scientists generating science, and now I'm here talking about how to bring science into policy. I'm not going to make a long statement because I think the most interesting part of this fora is the interaction with you and the questions that you might have. As many people have said already, the World Organization for Animal Health, we are part of the quadripartite, and as in the introduction was mentioned, we are caring about the quality of medicines and the responsible use of antimicrobials. And reacting to some of the comments that have been made before and the potential absence of targets in the animal health sector, we believe that we have strong targets. We do not maybe have numerical targets, but we have one which is all the countries have to commit to use antimicrobials responsibly. And let me be very clear, in terms of responsible use of antimicrobials in animals, this is only medical veterinary use. This is only for treatment, control, and prevention when there is high risk of infection. Animals, in terms of animal health, they need antimicrobials to survive infectious diseases. But in terms of animal health, they do not need antimicrobials to be raised faster and grow more than what they should normally be doing. In the political declaration, in collaboration with the member states, we've worked a lot in prioritizing something that has been mentioned here for other sectors, which is prevention, prevention, and more prevention. And I'm saying this 3 times because prevention starts with raising the animals and having the animals in the right conditions so animal welfare is preserved. Then the second thing is what in human sector they call infection prevention and control. We call it biosecurity, preventing infections from getting to the animals. And the last one is vaccination. Vaccination is an area in which in animal health is completely underestimated the value that they have, and the investments in vaccination in animal health are really low. We have another commitment in the political declaration, which is ensure that the countries have, by 2030, implemented strategies for vaccination for those diseases for which vaccination can reduce the antimicrobial use. And this is the way where we can reduce the use of antimicrobials in animals and therefore call for a more sustainable world. And the last comment that I wanted to make is, in the revision of the Global Action Plan, you have seen the 5, 6, 7 elements that JP was presenting, and one of them is encouraging the One Health approach. Many people come to us saying, but what's One Health? And we have already a definition given by experts backed by science and the knowledge that we have behind that. But in practical terms, One Health, it means talking to each other. When we talk about the quadripartite joint secretariat, you might think, okay, this is a very big structure within 4 global organizations. Well, this is JP, Junsia, and Eitziber, who is not here. This is us talking every week. Every week. What we would like to see is in every government, in every nation, this kind of coordination mechanisms where the 4 sectors are talking to each other, not every quarter or every semester, but every week. We were talking before about data integration. Data integration, it can sound fancy, but the first thing is data sharing. In many countries, what we see is that the sectors do not want to share the data with the other sectors because they are still pointing fingers and blaming each other. Those are the things that I think have to be improved in the Global Action Plan, including another aspect, which is the social behavior, human social sciences, because we are humans after all. And as someone said, it's not my quote, this one, but the biggest challenge in antimicrobial resistance is the natural resistance of humans to change. Thank you.
Thank you very much. Before we open this panel for questions, already make up your mind about the questions. I now hand over to Thomas Dengden. He's an infectious disease physician and he is chair of the Swedish Strategic Program Against Antibiotic Resistance, STRAMA. The project leader of Platinea 2.0, which is a collaborative project promoting availability and individualized use of antibiotics. He is also medical advisor of the global resistance network REACT, founded by Otto Kaas, whom I really appreciate a lot. So, Thomas, please.
I will keep it short to leave time for discussion, but I wanted to make some comments. First, on the revision of the Global Action Plan. A plan is only a plan. We need to implement it, of course. And this is discussed also in the previous session. We need to understand that this is going to be really costly, but we need the evidence to show that inaction is also costly and even more costly. I also think that from the previous session we got some really good examples of real life experience, and that I think we need more of that type of stories where you actually tell other people how you prioritized, and then going back to the basics and reality. I completely agree with the comments Chantal also made about the communication problem of AMR. We're making a really complex problem even more complex by using difficult terms. AMR is really difficult to understand, so we need to work on that part for sure. Regarding the independent panel, I think the critical point is how independent should it be? From the previous presentation, it's clear that intergovernmental is not independent if you need approval for every sentence in the reports. So how can we balance this? Because it couldn't be too independent either, because then it will lose its relevance. And we need people in the panel that really understand the policy landscape and how to convey your messages in one sentence to make action really happen. Regarding the tasks of the panel, I guess the main thing would be to summarize available evidence and highlight knowledge gaps, and to translate that to policy. But I think it's also important that we state which research topics are not relevant anymore, because we already know that you should wash your hands. I mean, if we could skip some of the studies that are just repeating things we already know and help put the resources in the right places, I think that's also an important task for the panel. I will stop there. Thank you.
Yeah, so let's open the floor for discussion. We have 8 microphones spread all over the room here. For those who want to raise questions, please give your name, your affiliation, and then also spot who should give the answer to this question.
Can you hear me? Thank you for your comments regarding this. The independent panel is something that is very exciting to hear about. And my name is Jumana Masmar. I'm representing the United States, and I wanted to share our experience with the Presidential Advisory Council on Combating Antibiotic-Resistant Bacteria. Having been the executive director for the past 10 years, everything you said, Sabiha, on point. So I love the structure that you provided, and I wanted to emphasize, as a comment, the need for transparency and also including public comment into the proceedings. Getting the expertise externally as part of our journey that we've had as a council has been incredibly imperative, because as many representatives that you can have on the council, you can't get everything. Especially if you need that representation from the LMICs and countries that are mostly affected by AMR, one person is not going to do it. So you need, because of the different domains and One Health, you need to be able to open the platform for everyone for a truly transparent conversation. So I just want to say thank you for everything, and that was just a comment I wanted to make.
Many thanks for that question. We'll take the next question from microphone number 5.
Thank you. Yes. So it's Karine Naim. I work for Doctors Without Borders. And listening to you talking about in the independent evidence panel, I'm wondering, you mentioned that the role is only to assess evidence that's out there rather than generate new ones. But we know that many low and income countries do not have much evidence out there on AMR, so there's a lot of knowledge gaps. What role do you think the panel can play to redress this knowledge gap? And maybe, I mean, giving some examples from the IPCC, from Dr. Abdallah, and maybe thoughts from Professor Sabiha as well. Thank you.
Oh, okay. Okay. Thank you very much. Yes. The research is there. I think because researchers are doing research, and we can find research everywhere, and also, of course, with some difference, some really some region have are producing intensive research. Other region are not. But what is really important is any panel, if the panel is starting to assess and to do the research, it will be a sort of bias. So what the panel should do is to say, this is a level of research at international level. But at the end of the cycle, and this is what IPCC is doing, we are assessing what are the gaps. And by producing those lessons learned about region that needs more information, more research, we are just motivating researchers to do the research on those areas. And this is because otherwise, if we mix the role of an assessment panel with scientific institution, it will be problematic. And I made it clear that if you want to work on an interface, we should not duplicate. We should not duplicate the work of the researchers, scientists, and you should not duplicate the role of policymaker. You should be there as really, you should keep, and this is the word of terminology is very important. You should really play the role of the interface and take it exactly with the meaning. You should not duplicate. You should assess the gap. And for example, if you follow the report assessment from IPCC, here assessment after assessment, you can feel that many regions are also documented in proper way because we detected that we did have some gap and we motivated scientists to do the research in those areas. But we are not doing research, we are assessing research.
Can I? Yeah, thank you. Is it on? All right. So just to complement what Abdallah was saying, I think that's the safest route, actually, that I also think we should go with AMR. Because we already see the discussion we are having with different organizations that some are worried that the IPA is coming to replace existing surveillance or research initiatives, which should not be the case. However, I think the evidence panel can also help to advise on the methodologies being used for the research purposes. That's something they can do. But importantly, is the independent panel as well to identify where the gaps in evidence are and point those out to the scientific community and the others to do the appropriate research endeavors. Now, to Jomana's point, I think I agree with you. I believe as well the independent panel should be open, should be transparent. I think that's what we learned from IPCC as well, including those comments from different people. That will be critical, and I think we will really follow that route as well. Now, the terminology is also key, and I want to say that we're going to go into this consultation and discussions, but already we see when you say intergovernmental, people immediately think it's not independent. But there are other people who have actually been advising us and saying the independence we're talking about, it's about independence of science, right? So the science, if it is well supported, as Abdallah was showing us, I don't see how, even if it is intergovernmental, that the governments are going to push it back or to not like it. Just to a point, I don't think we should completely rule out intergovernmental at the moment because we need to define what the independence we're looking for. And then would intergovernmental and independence can't go together really? I think they can. If we just clarify what the independence we're talking about. I'm not pushing for any at the moment, but I want to all open up the discussion really on a really complete, well-understood terminology.
Sure, so I'm going to answer quickly in a different way. When we speak about data gaps and knowledge gaps, I see it as data that we are required to understand the nature and extent of antimicrobial resistance, especially in the low and middle income countries, because we know that we don't have robust and representative data from there. I suggest that that be done in parallel with looking at adapting and adopting interventions. So we all know that AMR is as a result of AMR-specific causes, so indiscriminate use, overuse, and misuse of antimicrobials, and then it spreads because of inadequate infection prevention and control in healthcare facilities, inadequate water sanitation and hygiene in communities, and then vaccination also plays a role in it. So we know that all of these, the presenters in the first panel gave us all of the ways in which there are existing interventions. The challenge is to adapt those interventions such that they can be implemented successfully in different resource settings. In low and middle income countries, resource constrained settings, and then the International Center of Antimicrobial Resistance Solutions uses implementation research to do exactly this. We define the context, we identify all of the stakeholders, those that can help and those that can hinder the implementation of an intervention, and we take it step by step in terms of how to do that. So it's doing things together, identifying the nature and extent, but also at the same time finding ways of implementing existing interventions into different country contexts. Thank you.
Yes, about independency. So to me it means sort of choosing what type of research question you're focusing on. So can the governments tell the panel which priority areas to focus on, or would it be up to the panel to decide? They can, of course, have suggestions from other people, but ultimately someone has to decide. So that's a critical point for me. Second part is if you get some outcomes or results that the governments are not sort of expecting, is there a possibility that the government could stop or change the conclusions? That's definitely not independence. But maybe from the IPCC you have experience from this and solutions also.
Just to highlight something related to what we said, even in negotiation, in the approval plenary, the last word is for the scientists. Last word is for scientists. We have no statement which is not agreed by scientists. Government discuss, but at the end, it is scientists clearing the statement. This is just
I value really the credibility and the legitimacy of the panel, because it has to make a sense, it has to make an impact. And I think the best way to have it fulfill that role is really to be very well connected to the governments. Otherwise, it can be putting out their nice report, very well evidence-based, but no one is picking them up. And it's a big waste to me that I think we need to think on the ways that it is maintains independence in terms of the science that it contains, but really the government has full trust and buy into what comes out, because that's what is going to drive the implementation.
Many thanks for those responses. I'll ask for the next question out of the audience, please, from microphone number 3.
Yeah, good evening, and thanks to you all, and thanks for the opportunity to ask these questions. So, listening to the previous presentations and from the previous panels, we heard about the need to reduce antibiotic. We've heard about the need to reduce deaths caused by antimicrobial resistance by 10%. We also heard about WASH diagnostics. We heard about vaccines. But one key aspect that never came out had to deal with community antibiotic access and use. As I was quite excited to hear one of the panelists talk about the fact that in constituting the independent panel, there will be the need to include a sociologist and an anthropologist on that panel. And this was also re-emphasized by the statement by one of the panels, which I'm carrying home. And that is the biggest challenge of AMR is the natural resistance of the humans to change. This is quite critical because when you come to the low and middle income countries, especially at the community level, the sociocultural drivers of antibiotic use is quite critical, and antibiotics are easily accessible at the community level, and the kind of things antibiotics are used for are quite difficult to understand and comprehend. And so I would want to comment and also admonish that on this panel, or on this independent panel, we shouldn't lose sight of including that social scientists, the anthropologists and the sociologists, who will pay attention to the fact that issues around community antibiotic access and use, sociocultural influences are not missing out. Yeah, that's all I wanted to bring across. Thank you.
Thank you. I think we take that as a comment. We mentioned that, and it's very important. Thank you for stressing that again. So, number 2.
Thanks very much, and thank you to all the panelists for some really insightful perspectives and comments. Listening to your comments, your perspectives, and also trying to tie the two sort of panels, I've been thinking that antibiotics are a little bit like a patient in front of me with septic shock. The patient's dying, and it needs empiric treatment. Now, what you're talking about, and what we're talking about with an independent panel, is more like the directed treatment, okay? We've done the work, we've got the answers, and now we need to see how to implement. But how do you see this bridging? Because if we are to agree that the Lancet series interventions that Joe Lunard presented are correct, we already know that prevention and the specific issues around the vaccination optimization, wash optimization, hand hygiening, and IPC are going to reduce, are going to get us to that 10% target, and actually would have got us to the 20% reduction in inappropriate antibiotic use target as well, which didn't make it in. So we're discussing a panel that's going to occur, but that's not going to be in practice probably for another year, perhaps. By the time we've read the 100,000 pieces of literature and produced the first report of what we need to do, that's many years down the line. The patient's dying now. So how do we bridge that gap and actually say we agree with these potential implementable interventions in terms of prevention and actually get on with it? So that's what I'd like to ask the panel.
Well, no, I think that's a fair point, and I also mentioned this, that maybe some of the research questions that we're still asking have been already answered, and we can move directly to implementation. I also agree with you that we need to talk about the patients. That's the end goal. It's not about reducing AMR or improving the maps. It's about saving patients' lives. So in a way, it doesn't matter if the problem is an extremely resistant bacteria or it's an unavailability of even the most basic diagnostic tools to tell you what bacteria the patient is infected by and the susceptibility. I mean, that doesn't matter. It's about the patient. So I definitely agree on that, and I think it's important for this panel to also have a quick start and already describe what's out there before you read these thousands of articles and move on with the more difficult questions.
Yeah, thank you very much. I want to introduce some clarification. The 100,000 of publication are all for 6 cycle, but IPCC was established in 1988, and that time we were not using the 100. We were not waiting 100,000 publication. However, this is something which is interesting in your question. It is about hesitation or determination. And I think something we succeeded in IPCC is to introduce this uncertainty language. And I think in our statement, any paragraph is, is ending by virtually certain, very high confidence. And the other one are medium confidence, and we are sometimes even using language like low confidence. But to make the process for your panel as appropriate as possible is you can also, all these statements with very, very high confidence can be introduced. And this will be used just to ask for take action. The one with medium confidence or low confidence needs some further research. So I think it is about to gain the time and also to take benefit from the equivalent experiences. Thank you.
And also just to say that the Global Action Plan is the strategic framework that governs the work of the quadripartite. And if we look at the 5 strategic objectives, each of the quadripartite organizations have developed technical guidance on how to mitigate AMR along those 5 strategic objectives. So I don't think we're waiting for the independent panel to give us more evidence it's not a point of waiting for more information, but rather continuing to work with what's already there while the independent panel does what it's meant to do in terms of its terms of reference. And JP, you can correct me if I'm wrong there.
Your point is very provocative. I love it. You want to go fast and you want to go well. So, but that's not easy in policy making. But what I wanted to say is that when we say independent, what we are thinking of is to have a body that is not only heard, but is also listened by policymakers. And then the second part that I wanted to bring into the complex equation that you're bringing here is that I think in addition to the social sciences, I think we need to introduce economics, because I think that economics is going to move the needle faster in some of the places that we want it to be moved. And the Global Action Plan today, there is a 5th pillar in the building the economic case around the AMR, etc. It's a weak pillar that we have today that we need to strengthen, not only in the human sector but also in the other sectors. And whether we like it or not, money can make the needle to be moved. That's my contribution.
So many responses to Mark's provocative questions. With that, we'll, in sake of time, take 2 more questions from the audience. Please, the person from microphone 8 first, and then from microphone 5.
Hello. Thank you for giving the chance. I'm Hasnain from Bangladesh. I'm representing a tech company. So recently we have started an AMR awareness campaign. It's basically cultural relevant contents based on game technology. Since it's also aimed towards public, and since 90% users of AMR antibiotics are being used by primary cares, mostly by intentions of the patients, how can such grassroots developments be actually integrated to the national level policies or global policies?
Who wants to take the question?
So you're asking about how do we implement interventions at community level. I think that the Global Action Plan and its guidance, especially when it comes to education, awareness, IPC, WASH, infection prevention, optimal use, focuses both at health facility level as well as community level. It's meant to. And yes, the health facility interventions are far more advanced than those at community level, but there is work that is being done at community level as well to mitigate, because we do know that the vast majority of the antimicrobials are used at community level, and that should be the focus of our interventions. Yeah.
Perhaps a brief add to this. All these initiatives are not only important but necessary, but they are all backed by these national action plans, global action plans, and they will be even more backed by an independent panel. At least that's That's the idea behind it. That's a support, you know, a support for all these activities. And if you have global support, it should make a difference. Number 5, no? No.
John Rex?
Absolutely. So John Rex, AMR.Solutions. Fascinating panel. And listening to this, when I'm 37 years of you've been doing this, Professor Moxit, for 37 years. There are, every day, the Minister of Finance receives hundreds of messages about this problem and that problem and the other problem. And what did you do along the way to maintain the interest of all the ministers of finance? That to me is the really interesting thing. How do we, because every other problem in the world is making noise all the time, knocking on the door. Money, money, money. How do you maintain the focus? And the energy, I would say.
Yeah, I think, first of all, I want to start by also highlight that mainly in our working group 3, in IPCC we have 3 working groups and 1 task force of inventory. The working group 1 is dealing with physical science, just science about climate variable. Working group 2 is dealing with impact and vulnerability. It is totally connected to Ministry of Agriculture, Water Resources Management, Tourism, and so on. Working group 3 is about mitigation and all what is connected to the solution. And someone said if we are, interested by other science. Now, in this working group 3 outline, we have always chapter about finance. And this chapter about finance exactly is really listening, once again, it is listening to any studies related to finance, finance mobilization, and if they are translated in peer-reviewed literature, they are assessed. So I think this is, something that is, assessed. The drafting team is providing the necessary information, and by saying that, because it is something from government, ministers, policymakers, they are, of course, they are waiting and to receive any information that can help them taking decision. What's best is to find something, a paragraph, one summary for policymaker providing the good advice. And this is how these ministers are trusting the assessment, because this assessment, they are, for the moment, they are the only one coming backed by science and also tested, discussed, negotiated during government between them. This is, I think, the approach, and this is how this is, making assessment of IPCC more, let's say, credible and more accurate. This is the approach, and you're right. I think the degree of confidence in assessment is increasing. As I said already, the last COP was 19% all of them raised IPCC as robust science assessment documents.
Many thanks. So with that, we would like to thank the panelists and the speakers. In summary, you heard about the importance in distilling many, many scientific know-hows and information into 10 commandments, and keeping the steady flow and having the ministers, in particular the financials, interested in the topic, and really making it that simple that everybody understands the message, and that you listen to each another and have this communication going amongst all the different interest groups. So with that, I would like to thank everybody, also the audience, for their attendance and the questions. And I would like to ask Kevin to quickly come up as well, following Robert. Many thanks.
So we're getting to the end of this really exciting 2 sessions here. But what it says here is closing remarks and next step. And there is actually a very close incoming next step. And so I would like to invite Kevin Otterson from CARBEX to just inform you a bit about this, and then we'll close.
This is actually an academic project in my role as professor. If you could put the slides up, or do I have to advance? So the thought here is just what you've heard from other panels. There's actually a lot that we can learn because we are building global health architecture. We have the Global Leaders Group. We have the Multi-Stakeholder Partnership Platform. We have the ministerial happening every other year, the next one in Nigeria. How does this piece fit into those, and what can we learn before we march off and do something like this? So we thought that it was important to have an academic activity here in which people who've studied many of these panels for years, some of them have critical things to say about various panels, and also good things. These are things that should be emulated. These are things that should be changed. It's sponsored by the U.S. National Academies of Science and the Nigerian Academy of Science, funded by Wellcome Trust and by Boston University. Javier, myself, and Iruka are the co-chairs. This will not be a platform-heavy event. It will have some very short interventions, mainly from people who are experts on these other panels. And then the audience, which will be high-income people, will be a minority in this audience. The audience will be AMR experts who will then have dialogue. Most of the meeting will be dialogue around tables of 8 to 10 people discussing how this would or would not work in our context. And I have to say that, when I first looked into this, began pursuing this idea, I knew of a couple of panels, but actually our program, there's a lot of panels, and if I was being truthful, I could give you another 100 or 200 panels. But these are the ones that we're focusing on. There's a lot of things that are happening, and some of these panels you've never heard of, even though it might be close to your discipline. That's a warning to me, right? We don't want another set of international bureaucracy that actually doesn't do anything. I take Mark's warning to heart. Finally, there's papers that we'll publish. This meeting will be at the end of April. We're in coordination, I guess is the right phrase. JP, tell me if it's not, with the Quadripartite Joint Secretariat. These papers are designed to help feed into this process. They'll be available publicly, pre-reads for the conference, and then they'll be modified based on what we learned at the conference and very shortly thereafter put out. But our goal is not to come with any hypothesis, but actually just to come with questions and with some information about other panels, and then talk for a day and a half in Lagos, Nigeria at the end of April of this year. So with that, I turn it back to you. Thank you.
So one of the reasons we wanted to highlight this is that we have actually been invited there as well to share the information that we got here from this very exciting 2 panels. So on behalf of ESCMID, I would just take the opportunity to thank both panels, the speakers, and I especially would like to thank you, Dr. Moxit, for coming in, and Joe Leonard to come in from outside, if we can say so, and tell us all your experiences in this year. I think when we are starting to distill what has actually been said, it is actually quite complex, as was mentioned from the beginning, and there is a lot of things here that needs really to be thought through in order to get this one here really progressing. If it has been easy, it has been done for a long time ago. So I think the 2 panels, science to inform policy, and now this policy to drive action, that is really essential for us to, as scientists, to understand the policy questions and to incorporate that in our scientific reality. Otherwise, we will miss the opportunity to speak to the policymakers and to make them do scientific, valid interventions. So with this, I would like to close. I don't know, Lothar, will you have a last word, or otherwise we'll close here?
Sabina tells me I have to have the last word. how can you resist such a wonderful woman? So, yeah, thank you so much, Rob. It has been a pleasure, and I think from the side of the Global Leaders Group, we appreciate that, because obviously there can't be enough discussions with friends, and particularly with colleagues that have a big competence. Let me briefly sum up what we said here on that panel, basically regarding the independent panel. And this is something that we all should know. There should be clear roles, clear definitions, accountability, responsibilities. That's number one. Without that, life gets hard. We need to have trust between different groups. We need to respect opinions. We need to respect knowledge from other sides, really important. We need to be transparent. Also, coming back to what just has been said by Kevin, yeah, of course, no duplication. Yeah, no duplication. We have enough duplication that's ineffective and it's inefficient, it's costly. And obviously we have anyway to identify gaps. And what I most liked today was when Abdallah said the last words have the scientists. With that, let's have a nice reception.
And as said, we do have a network receptions out here with a bit of drinks and a bit of food for all of you. And please take the opportunity